The Foundation for the Children of the Californias, a binational nonprofit corporation dedicated to promoting the health and nutrition of infants and children in the border regions of Tijuana, Mexico, and San Diego, California. Throughout the past 20 years, Dr. Chong King, Dr. Jones, Dr. Richardson, and Dr. Collins have worked together as both healthcare professionals and volunteers, addressing the medical, emergency, and nutritional needs of children in Tijuana and the surrounding area. They are here to discuss the critical health care needs of children, as well as some of their highly successful programs, which have, over time, led them to the creation of the Foundation for the Children of the Californias. Dr. Chong King speaks from his own perspective as a pediatric surgeon, as well as from the experience he has gained from 12 years as director of a major hospital in Tijuana.
Baja California is one of the few states in all of Mexico that doesn't have a children's hospital, even though 50% of the population is under the age of 18. In Baja California, accidents are the third major cause of death in children. Any child, regardless of social status, is likely to get into an accident. We don't have a hospital that can provide comprehensive care in response to critical trauma in children. The first hour following an accident is the most important one if we're to prevent irreversible problems. Right now, it can take more than 2 hours to get a child across the border and admitted to a hospital, making the chances of irreversible damage very real.
Border traffic is a constant and time-consuming barrier around which there is no quick or easy solution. When an accident involving head trauma occurs, the golden hour, that first hour within which treatment must begin, quickly ticks away. Among the estimated 1 million infants and children living in and around Tijuana, a minimum of 84,000 of them will require medical care each year. Conservative estimates suggest that more than 60% of these youngsters will not have access to the care they need. In addition to accidents, the most common problems in children include severe malnutrition, respiratory diseases, and diarrhea, a serious issue because it leads so quickly to dehydration, starvation, and even death. Access to care is the obvious and inevitable solution. It is said that each physician will treat over 150,000 individuals in his or her lifetime, making education one of the most powerful tools we have to work with. This foundation is committed to building that hospital. Located 2 miles from the Tijuana airport and 1/2 mile from the Otay border crossing, this pediatric hospital will be the first of its kind in all of northwestern Mexico. Open and staffed on a 24-hour basis, it will serve as a leading center for diagnosis, assessment, research, education, and treatment. It will send medical teams out into the community, bringing medical care, education, and service to large numbers of children and their families. And it will serve as a primary resource for physicians, nurses, researchers, and educators. Trained specialists from both sides of the border will continue to work together to make this dream a reality, assuring accessible treatment and care for children in need. Construction will be completed in 2 stages, beginning with Darte and progressing over a period of 10 years to a full pediatric facility with 82 beds. The projected cost of the entire 82-bed hospital is $12 million, with $6 million as the immediate fundraising goal. We've had an excellent beginning. The land needed for the hospital has been generously donated by the governor of Baja Norte, and over $250,000 in professional services were contributed within the first years of planning. The remaining funds, coming from individuals, governments, corporations, and foundations, will allow construction to begin by the end of 1994. We have before us an opportunity to accomplish a great and wonderful plan. Please join us so that when children raise their hands in need, help will be available. The Foundation for the Children of the Californias, building a better tomorrow today for all our children.